Okay, so I would like to go ahead and introduce our presenter, Jim Lawson. If any of you have been to any state or national meetings within the last 5 years, you've probably seen Jim. Jim is constantly sharing his wealth of ABC knowledge with all of you, and today he is going to be focusing in on privileging. So I will turn it over to Jim to get started. Jim.
Well, thank you, Megan. I appreciate it. Everyone, good day. What a pleasure it is to be able to spend this time with you and share the time with you. I appreciate your time very much. Now, before we begin, I would like to kind of get an idea of where we are as a group. We have well over 300 attendees on this webinar who've registered for the webinar. So let's hear where everyone is on privileging. Megan had talked about a poll. Let's go ahead and do one of these polls very quickly. Megan, can you bring that up for us? Let's take a few moments and share the answers with you regarding your privileging, and then we'll see what the results are. So the question is, are you using privileging in your patient care practice? And you have three choices. Yes, I'm currently using privileging. I am considering privileging, or I don't plan on privileging, and I have no idea why I'm on this webinar right now. So go ahead and take a few moments and make your selection, and we'll go ahead and share the results with that. In the meantime, Megan, I can sing or do mime, one or the other. So we have the results coming up. Okay, very good. So as of right now, 43% are saying, yes, I'm currently using privileging, 47% I'm considering privileging, and 10% say I don't plan on privileging. Well, that's great information. That's a good place to start. That's very interesting. In my position here at ABC, as Megan said, I have the honor of traveling all over the country year-round, and I have the pleasure of meeting many of you who are attending this webinar face-to-face. As I meet you, I speak at these state and regional and national meetings, and I generally speak on accreditation. I'm talking about compliance and accreditation, and during that time, I do add in the topic of privileging. Now, during these opportunities, I sometimes see very blank stares when I ask the attendees if they're using privileging within their practice. Generally, after I give a brief explanation of what privileging entails, the stares generally start to turn into nods, and that usually means, yes, there are some people who are using privileging. So, what we felt like we'd do is there seems to be a certain amount of confusion around the subject, and I want to take advantage of this webinar time to explain exactly what privileging is, who can do it, and the importance of performing it correctly, as well as how it should be done in the specific documentation that's required for compliance itself. So we'll take the majority of our time to walk through these topics, and as Megan said, then we'll have some time at the very end for some questions and answers. We will make this as brief and to the point as possible for everyone today. So let's start with the basics. What is privileging? Now, the ABC scope of practice breaks the definition down into two categories. The first one, the supervision and privileging of a credentialed caregiver, and the second, supervision and privileging of a non-credentialed caregiver. So these are very two distinctive definitions. Let's start with the first one. The privileging of a credentialed caregiver. Quote, privileging of credentialed individuals to provide services beyond their defined scope of practice must ensure appropriate, effective, ethical, and safe delivery of patient care. The credentialed caregiver may be privileged under indirect supervision to provide patient care beyond their scope of their credential based on written objective criteria. So let me ask you, did you pick up that phrase, indirect supervision? Indirect supervision. That's a pretty important part of the definition. So let's discuss what ABC seems and deems appropriate as indirect supervision. Indirect supervision does not require the supervising credentialed individual, the supervisor, to be on site. However, they must be available for consultation throughout the patient care process. So what does that mean? They must be available throughout the patient care process. Let me make it clear. Patient care process is any time a patient is actually receiving care by you or your staff. So, what acceptable ways could a supervisor be available? Now, I've heard some of the rumors, and practitioners have told me you must be available within a 60-mile radius. Now, I don't have a tape measure that long. it's not going to make it there. Maybe just a rumor, but I heard it was probably from the horse and buggy years. I actually did a little bit of research on this, and in ABC scope of practice from the early 1990s, it does mention a 60-mile radius, but that wording has been removed long since. So the 60-mile radius is right out. Now, for indirect supervision option, the telephone is an option as well as being supervised and in the office, yet treating another patient, but available for any consultation and supervision that is needed. Indirect supervision does not require the supervisor to be on site again. However, once again, they must be available for consultation throughout the patient care process. I know I'm getting really specific and I'm kind of hammering this again and again, but this is really important information. Now, let's take a look at the other privileging option, the privileging of a non-credentialed caregiver. The second definition is of a non-credentialed caregiver, and it states, supervision and privileging of a non-credentialed caregiver must ensure, again, effective, ethical, safe delivery of patient care. The non-credentialed caregiver may be privileged to assist in the provision of patient care basis on written objective criteria in situations where either prosthetic, custom fabricated orthotic, or custom fit high orthotic items being provided in the initial patient assessment, formulation of the treatment plan, and the final fitting and delivery must be done under direct supervision. Okay? So, a couple of words in there. One of the key ones, the first one was assist. That's a key word. Assist, participate, play a certain role. That's really important here. So, let's move on to direct supervision. Direct supervision requires the supervising credentialed individual, the supervisor, to be available in real time for consultation throughout the patient care process and to be available to assess the care being provided by visual means, i.e. physically present, live video, webcam, or any other means of live visual technology. Now, ABC accepts being available by different means and tools, and it's acceptable for ABC to use media tools such as Skype or FaceTime. You're familiar with those, where you have an immediate visual and audio aspect to the tools. Now, if you're using Skype and FaceTime, I really encourage you to make sure you have a very strong Wi-Fi signal, that it's not going to fail in the middle of providing patient care. So, direct supervision option. Direct supervision requires the supervising credentialed individual, once again the supervisor, to be available for consultation through the patient care process, to be able to care being provided visual means. We talked about the webcam, we talked about all of those different things. Please remember that these tools and resources must be used in real time, not a recorded video. It must be live. For example, if an ABC surveyor is at your business, and you must be able to show the surveyor how your system works in real time. It's more than likely they will ask you to show them how your system works, and they're going to ask you to run a test on the system. No matter what system you use, if you're having a survey and they see that you're privileging, they're going to request that you show them exactly how it works. Let's move on to this. No matter who is being privileged, they must all have the following: a written objective criteria. The ever-confusing written objective criteria. You must have one for each team member who's being privileged. Okay, so what exactly is a written objective criteria? ABC defines it as the means by which a privileged caregiver's ability to provide specific patient care service has been assessed and documented. I'm going to say that again. It's the means by which a privileged caregiver's ability to provide specific patient care service has been assessed and documented. Now we're going to go a little more deeper into that, so it's going to help you clarify it all. We're talking about the structure and mechanism of how the caregiver has gained the necessary knowledge and skills to be able to provide the specific patient care service, and it must be clear and related to the diagnosis involved or the orthoses or prostheses being provided, the device itself. Okay? Are you confused? It's easy to get confused with this, but it really is very simple. It's very specific. Hope you're not confused, but I'm going to break it down even further for you in just a few moments. The documentation that is required may take on different forms, including, but not limited to, proof of completion of continuing education courses related to the specific diagnosis or device, documented in-house training or in-services that are, once again, specific to the patient care service that the caregiver is being privileged to provide, or documented specific work experience participating in patient care activities, or other documented criteria that is suffice for the documentation. There are some others, just other examples itself. And if you have other documentation, you please provide those as well. Okay? Now, did you pick up on that? Being privileged, no matter who you are, okay, everyone's seen this. Every prosthetist has seen this movie, right? Morgan is not a prosthetist. Being privileged, no matter who you are, does not mean that you have carte blanche to do any work that you feel you can or want to do. It must be specifically related to a diagnosis and a device. So, let me give you an example here. If you're privileged, let's say, in an Arizona AFO, the device, to treat paralysis of drop foot in a stroke patient, okay, that's very specific, okay? Arizona AFO, the device, to treat the diagnosis, paralysis of drop foot in a stroke patient, that does not mean you're immediately also privileged for Arizona AFO, the same device, for treatment for PTTD, posterior tibial tendon dysfunction. Okay? Does that make sense? There are two different diagnoses. You are privileged in a very specific task. If you wish to be privileged in other tasks, you need to have that written objective criteria and the other documentation for that task as well. So, please don't let privileging creep happen. That's when a person is privileged with a certain device and a certain diagnosis who begins to creep over the line of what is specifically covered in their written objective criteria. So, now I have a question for you. Have you picked up on how many times the form of the word documented has been used? Right? There must be specific documentation throughout the entire process. This profession, seriously, it's nothing if it isn't documentation. We all know that. So, a log or a checkoff sheet is really not adequate by itself. There needs to be other substantiating documentation that supports what is described in the log, okay? The documentation needs to support what is described in the log. So let's discuss some of the different pieces of information and documentation that should be in the written objective criteria. Remember, this documentation is something that continue to be added to. It can continue to grow. It's a living documentation, okay? I think we'll be clearer when we see the written objective criteria example coming up in just a few moments here. So let's break it down, all right? Let's break it down to what, where, when, who, and how. Are you ready? Here is what we need to see. Content. What is the specific diagnosis being treated? What is the specific intervention being learned? So content, specific diagnosis, specific intervention being learned. Format. Where did the learning take place? When did the learning take place? Who is the preceptor? And which organization did he or she represent? Okay? Documentation of all of that information. Process. How did the privilege privilege progress from observation to assistance to independence? How did that privileged staff member progress throughout the process from observation to assistance to independence? Now, here is a great example of living documentation for privileging, all right? It's telling us a story. This is what we need to see. The documentation is telling us a story of who, when, what, and it's very specific to the diagnosis and device. If you take a look at this, Joe is being privileged, and here is his story. It tells us what he's being privileged in. Remember, all of us, through all of our documentation, through all of your compliance issues, through every standard, and whenever you have a survey, I'm going off book a little bit here. Whenever you have a survey, the surveyor comes in and says, I want to see the story. The documentation is going to tell us a story. Your patient notes are going to tell us a story. Think about the same way when it comes to privileging for your written objective criteria. You want to tell that story. Okay? Like I said, Joe's being privileged. Here's the story. It tells us what he's being privileged in. It tells us his training. It tells us who's done the training. But it also tells us Joe's progression throughout his privileging process. So one addition here, we also would like to see the justification for needing to privilege a team member. Okay? Why did you make the decision to privilege someone? Is it because you as the practitioner can be working on something more extensive with another patient while the person who's being privileged is working on something far more elementary, and so you're being able to see the two patients at the time and you're saving time and you're being accommodating the patient's time and being aware of your responsibility to them? Whatever the justification may be, we need to have that down as well. So once again, all privileging must be specific to the type of an item and the service being provided. Now, with that said, ABC also has a few great resources on Accreditation Resource Pack. It's our Accreditation Resource Pack on our website. These are available on our website at abcop, real simple, abcop.org. Just log under your accreditation username and password after you click on the big red My ABC box in the main page, that box down in the right-hand corner. And like I said, it's your accreditation username and password. It's not your individual certification username and password. It's the accreditation username and password for your business itself. And if you're with an ABC accredited facility or a boutique, you have these tools at your fingertips with no extra cost. The first is titled Instructions for Using Privileging Criteria Template. There we go. And the second is an actual privileging criteria template itself. If you're accredited with ABC, they're there waiting for you. Please go ahead and take a look at them. You may have something that's even further extensive than these. If you do, that's fantastic. Continue to use it. But if you don't have anything, this is a good start. Now that you have sufficient written objective criteria, let's move on from that. What is your responsibility as the credentialed supervisor? Good question. First, you must review all notes written in the patient's chart by the privileged team member. Second, you must co-sign those notes. And thirdly, you must date them. Okay? Review, co-sign, and date. Now let's not get away from the reason why you're doing that, and you're reviewing, you're co-signing, and dating. I want to make it very clear and put a little extra emphasis on this, because basically as the supervisor, you are saying, as you review the notes and sign off on them and date them, I agree with this action. I agree with it, okay? Now, your review, co-signature, and dating must happen within 15 days. 15 days of the privileged staff members performing their services. 15 days. Today is Tuesday. I have a question for you. Can you remember what you had for lunch last Thursday? I cannot. I'm telling you, I can't remember what I had for lunch yesterday. 15 days is a long time. I think ABC is being very generous with those 15 days. So I kind of urge you to review and sign and date the notes in a timely manner. So now with that being said, it's extremely to remember the important point and follow this. Everything that is done by the privileged staff member is done under the supervisor's credential, under your certification. It's basically the buck stops here, as it were. That gives you a great incentive to make sure everything is being performed properly and that all the documentation is suffice and it's in the correct place. Where are you keeping the documentation? The documentation for that privileged staff member should live in the personnel file. And if a surveyor does come in and say, are you doing privileging? And I see you're using it. Say, yes, it is. Who's being privileged? This member, this staff member, and this staff member. Great. I would like to see those personnel files to make sure the full documentation is in there. That will definitely happen. Now, I've had practitioners tell me that they will not have a patient leave their office until they have reviewed, co-signed, and dated the notes. I've had other practitioners around the country tell me that they review all patient charts that a privileged team member has worked on by the end of each day. They don't go to bed that night without reviewing those charts, okay? Remember, if there's any problem, you want to catch it as soon as possible. It's your responsibility. If the privileging for delivery of an elementary device, here's another note, privileging for delivery of an elementary device or something, I don't know, something very simple, you may not feel the need to review and sign off those notes immediately. But if there's something being done to change a device, to alter a device, you would want to review those notes as soon as you were able to. Because remember, your business could be at risk if mistakes were made and not rectified. So I've given you a lot of information so far and quickly on privileging, but with all this in mind, let me throw you a curveball. As of right now, we have 15 states in the United States that are practicing licensure for our profession. The state licensure supersedes ABC's privileging standards and rules. Oh no, right? Fortunately, most of the licensure states follows ABC standards. Fortunately, they do. But there are a few states that have their own rules, and you must follow those rules because you don't want to risk the losing of your license. For example, Florida defines, quote, supervision differently from ABC. The Florida Licensure Board states that general supervision is where a qualified supervisor is accessible at all times by two-way communication, that's the same so far, which enables the supervisor to respond to an inquiry when made to be readily available for consultation during delivery of care. Okay, that's good. But this is different, and is within commuting distance in reasonable geographical proximity. So, Oklahoma states the licensed orthotist or prosthetist is responsible for personally reviewing the work by the supervisee. Okay? A little different there. Now, what does all this mean? Basically, it means know your state. If you practice in a licensure state, please be familiar with your rules, what you can do, what you can't do. ABC has a licensure state map on our website, okay? It looks just like this map. It's very simple. The states that have licensure are colored in. Just click on the highlighted license state, and it'll take you to a list of all information about licensure in that state. It will also include, actually it's really in-depth information, it's very good. It'll also include the link to the state's licensure board's website. Visit that site. Read and review the specific rules. This is your livelihood, it's your career. We must be sure that we're as well educated on the state licensure rules as we can be. Now, that being said, and I'm with ABC, we also encourage you to be just as familiar with the ABC accreditation standards and the compliance with those that apply to your practice as well for accreditation. So, we've been through a lot of information here. It's very specific. You can be privileged in a specific task and a specific diagnosis. That's it. If you want to be privileged in else, you add to that. You have another written objective criteria. Okay? So I wanted to share some of the do's and don'ts when privileging. Just as a reminder, here's some of the points that we've kind of gone over with today. Okay? Hopefully I've answered some of your questions before they even came up here. So, do. Make sure you have all the sufficient documentation needed for privileging, training, justification, and the written objective criteria. Do. Continue to be educated and keep up with the new procedures, the new technologies, and the new standards. Being privileged follows along the same line as with your ABC certification, right? You have to have your CEU's minimum goals within every 5 years. Okay, we all know that as if you're certified. Here's an idea. Continue to update your privileged staff members' education as well. Okay, if they're doing the work alongside of you or underneath you, please make sure that their education is continuing as well. Do be available for supervision and consultation with a credentialed caregiver and a non-credentialed caregiver. Do review, co-sign, and date the privileged staff members' notes within a 15-day period. But do me a favor, just specifically for me, do it earlier as possible, okay? Do remember that the ABC surveyor will review all privileging documentation during your next and your following ABC accreditation surveys. We have had practices not take the privileging as a serious procedure, and honestly, I'm going to tell you right now, they've been penalized for the lack of documentation, for poorly constructed written objective criteria. They don't tell a story. Sometimes they use just a log, and that's not making it. And the patient charts are not being reviewed. They're not co-signed and dated. That could lead into a lot of trouble. Please, 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 I don't think anyone on this webinar is doing that. Please don't let that happen to you. How about some of the don'ts? Don't forget to review and understand your state licensure rules if applicable, if you're in one of those 15 states. Don't become comfortable with your privileged staff member and the services they're providing. Be aware of what they're doing. Be involved in that, okay? And how they're doing it, how they're providing those services. Once again, their work, and I can't hit this strong enough, their work is basically your work. And because it's being provided under your certification. So please remember, take that seriously. Just kind of a note for myself, I'd also like to share with you that if you don't feel comfortable or if you don't feel like you have sufficient documentation for privileging, either for a credentialed employee or a non-credentialed employee, my advice is to kind of hold off on it until you're confident that you have the appropriate required documentation. That's just a good idea, I think. Very good. Let us now move on. Megan, I think we've hit all the main points for privileging that I have available and that I've come up with. I think this would probably be a good time to have some questions. What do you
Yes,
think?
yeah, absolutely. We'll take some extra time here for some questions. Let me see what we've got. There was
And
one.
ladies and gentlemen, if I can answer the question, I will. If I'm not able to get the answer right off the top of my head, I will get the answer to the question for you, and we will add that into the email that we send out to everyone that Megan mentioned earlier. So just I want to make sure that's clear to everyone.
Okay, first question comes from Yolanda, and the question is, would email supervision suffice for indirect supervision?
Um, for indirect supervision, email, no, they need to be, well, we need to, the email should not be suffice for that. They need to be, you know what, I need to get the specific answer on that, Megan. I apologize. I apologize for that. Let me get the specific answer. It's a fantastic question. And I'm going through my notes here. It's a fantastic
Yes,
question.
absolutely. We'll put the answer for that. We'll reach out to Steve, who should definitely be able to tell us
Yeah.
the answer to that. The next question is, where is the IPR filed, or to whom is it submitted? Is it in the patient's chart in any form? And Jim, are you familiar with the IPR?
I am not familiar with the IPR. I
So
am not a
I
practitioner.
think
Yeah.
that's supposed to be their individual privileging record.
Oh yes,
Um,
the individual privileging record that would be located, since the individual privileging record is for the privileged staff member, that would be located within the personnel file of that individual staff member.
okay, so in the personnel file and not in the patient's chart, or could it be in both?
Well, it'll be in the personnel file. The notes will be in the patient's chart. The notes of the privileged staff member will be in the patient's chart, but the individual record will go into the personnel file of the privileged staff member.
Okay, great. All right, and next question. We have someone who has a supervisor who is BOC certified, and they're asking, can that person privilege them as an ABC certified fitter?
It is, as an ABC certified fitter, it needs to be under an ABC certify.
Okay, so
Yeah.
if you're an ABC certified fitter, a BOC orthotist, for instance, could not privilege you.
Should not be able to privilege you. That's correct.
Okay, thank you for clarifying that. It says, next question, is the date that the certified practitioner uses when they co-sign the chart and the date of service, or is it the date they co-sign?
It's the date of service and like I said, there's a 15-day period. The date of service when the privilegee, pardon me, not privilegee, but the privileged staff member services the patient and provides the service to the patient, that's when the 15-day limit starts.
Okay, and so are they co-signing for the date that the service was provided, or the date that they're actually like reviewing it?
Well, that's getting a little, I'm not sure I understand exactly the question, but if it's, we always start with the day that the service is provided itself, and I'm not sure what the difference would make.
So I guess when we're
So
saying they
I'm a little
have to
confused by that.
co-sign, then they have to co-sign the patient chart and then put a date on it. Are they
Exactly.
putting
Oh,
that date
no, I
15 days
apologize.
later?
No, I apologize. If you take 2 days or 3 days later to review the chart, you are co-signing it the date that you review the patient's chart. So we will have the notes from the privileged staff member in the patient's chart if, let's say, for example, if it's September 1st, and you as the practitioner review and co-sign it and date it on September 5th, Your date would be September 5th. I apologize. Now I understand.
Yeah, perfect. Okay. All right. Next question. Is there any difference in credentialing between custom devices and off-the-shelf devices for privileging?
Yeah, I think it depends on who's doing the work, and it goes into the scope of practice. And that, I think that's a whole nother webinar, and I understand that's an excellent question, but it goes into the specifics of the scope of practice, of who is certified, and what they're being privileged in. Our scope of practice is at the ABC website, abcop.org. You can look that up. I think that's probably going to be the easiest thing to do, is look that up, and it does have specifics of what you can be privileged in.
Okay, great.
I think we can spend another hour on that.
Okay.
And that may be a good idea for the next webinar.
Absolutely. All right, next question. Is an ABC certified assistant considered credentialed to provide supervision? So can a ABC certified assistant privilege someone?
If something is being done under their scope of practice, so the ABC assistant must be aware of their complete scope of practice. They are not allowed to go beyond their scope of practice in privileging someone else.
Okay.
That makes sense? Okay.
Yes. Next question, and this might be something we can't answer, but
Okay.
just to
Well,
throw
let's
out
try.
there.
Let's try.
Okay. Would a resident be considered a credentialed or non-credentialed employee?
That's a great question. Residents fall under a different category. Residents are privileged because of the work they're doing, and it's a fantastic question. And residents are privileged, but that's not the terminology that's used for it, under the practitioner, and because they also have a program director within the practice itself. So residents do not need to be privileged as we're talking in this concept here. They're under a whole different area, and they are automatically originally privileged.
Okay.
Good question.
Okay. Is somebody asking about getting a copy of the slideshow? And absolutely, we will have the handouts available in the follow-up email.
Now, my question is do they want the slideshow because my photograph's in it, or is it Morgan Freeman's?
Absolutely. That's exactly right. Okay, let's see what else we have here. Try to get as many questions as we can. All right. Is a certified orthotic fitter considered a credentialed caregiver or non-credentialed?
Up to their scope of practice.
All right. So same thing, as long as they're within their scope of practice. Okay, and let's see. And they're wondering if, let's see, Paulette is asking, are they supposed to be using privileging?
No, not necessarily. No, that is not the case. This is something that ABC recognizes. This is something that Medicare recognizes, and this is something that you can take advantage of, and it's out there. What we see is a lot of practices that are using privileging. It's a very good question. Are we supposed to be using privileging? No, not necessarily. There are practices that do use it, but what we keep running into is our surveyors. I speak to all of our surveyors, and they're traveling all over the country also and coming in and doing the surveys. What they find is there are practices using privileging, but they're not able to using it correctly. They don't have the sufficient documentation. People are doing work in areas that they're not privileged for, and ultimately, why are we doing this? It's ultimately for healthcare, providing the best healthcare possible. And if we're not following the rules by what is necessary, then we're probably not providing the best healthcare possible. So it is something that if you would like to use, that is great. But use it correctly. That's kind of where we're coming from at ABC.
Okay, next question, and I think I can answer this one. From Nathan asking what the difference was in the yellow-colored states on the licensure map. That is indicating that those states actually have some sort of requirements for O&P, but they do not have a formal O&P licensure law in place. So there are requirements there, but they are not a formal licensure law. So that's something that you would actually want to go ahead and click on that state. We do have links to those pages, and you would be able to click through and read what those requirements are.
Great.
Okay. Asking, do all privileged individuals have to be directly supervised? Can we explain more about the webcam and I guess the virtual?
Certainly. Um, what I want to make sure that we weren't stating that. So the question is, do all privileged staff members need to be? Say that question again, please.
Do all privileged individuals have to be directly supervised?
Okay, so if you're a certified staff member, remember I talked about earlier that it is indirect supervision, okay? And if you're a non-credentialed staff member, if you're credentialed, it's indirect supervision. If you're non-credentialed, then it's direct supervision, okay? That direct supervision, their supervisor must be available for any consultation. They must be available because they're assisting, they're helping out with that, okay? And it can be, when I said it can be with two-way video concepts, with FaceTime, with Skype. It does not necessarily mean that they have to be doing it every single thing that they're doing. They need to be right there and available, though, and need to be able for consultation and any direct supervision.
Okay. Let's see. Lots of questions about that residency, so I'm glad we
Okay, good.
took care of that one.
That was a very good question. Yeah, if you have residency programs, if you have residents in your practice of residency program, they are already privileged to do the work and progress throughout that 12-month or the 18-month dual residency that they're in your practice in your program, the residency program.
Okay, and this next one's a good question. I think maybe we might have to refer him to Steve just for some specifics, but
Sure.
let's see if we can get a general answer here. They use a long-term certified prosthetist to cover their weekend calls, and typically the calls relate to over-the-counter orthoses for a wide array of different diagnoses. And they're asking, is there any way to address this wide scope of diagnosis for over-the-counter items without having to spell out each diagnosis for each product?
But it's a practitioner who's doing that work?
That's what it appears, yes.
Well, okay, we'll get some more information about this, but if it's a practitioner doing the work, then I don't think so, because their scope of practice is covers that. But
So,
if I'm understanding the question correctly,
right,
I'm not
and
sure
what if they're privileging someone?
Oh, if they're privileging someone. Yeah, I think we'll get more specific information, and we can respond to that in the email itself. But I always go back to the specifics. This device, this diagnosis, you're privileged in that. You may be privileged in many things. You can be privileged in more than just one device and more than one diagnosis, but we need the training, we need the justification, we need to see the documentation, the written objective criteria for each of those.
Right, and it may be that one particular piece of documentation, let's say an education course, might cover
Certainly. It might
multiple.
cover more than one, yes.
Right.
Yes.
Okay.
And just as long as that's documented, yes.
Perfect. Okay, why would someone use direct supervision? If they feel like they're what would have been some of the answers that you've gotten before as to why they would want to use direct supervision as opposed to an indirect supervision?
Well, because direct supervision would be for a non-credentialed staff member. It's just that simple. So once again, the credentialed staff member, if you have a credentialed staff member working in your practice, they may use indirect supervision. For a non-credentialed, someone who's not sat through any ABC board exams for anything, okay, that would be a non-credentialed staff member. That's when you need to use direct supervision.
Okay, and they're wanting to know what would be some examples of how they would be productive in that way. And I just wanted to bring back in our presentation
Certainly.
You did have um, examples of direct supervision included, the web visual means of visual
Certainly,
communication.
they can literally in the practice themselves. They can be there at any beck and call for any advice, any supervision, any direct, anything along those lines.
But they don't have to be standing like over them, I guess is the question.
Right. Remember,
You're
remember,
thinking
we
if
right. We talked
they
about
are
privilege.
standing over the individual, then they're not getting their
Then
work
right.
done.
Then why privilege someone, right? At the beginning, they probably will be standing over the person. Okay. Remember, we discussed the progress that they make from viewing to participating to learning to getting to the point where they're able to do that service. Okay, so it's a progression. So at the beginning, yes, more than likely the practitioner is going to be right there with them. Okay, or the person who's doing the privileging is going to be right there with the privileged staff member. And then you progress to the point of you don't have to have your hand on the shoulder and watch every move they're doing. But once again, you want to make sure that you review every piece of work they're doing.
Okay, great. Next question from Dan. He's asking, can multiple certified practitioners um, supervise an individual?
The answer is yes. With ABC practitioners, the answer is yes. The answer is yes. So, for example, if we have a practice with 4 practitioners, we have 4 CPOs, and we have a staff member who is being privileged, and I personally have taught and educated, and I'm a practitioner. I've done the work with this privileged staff member, and now they're working. Any one of the other ABC practitioners could be their supervisor with that, so that's not a problem at all. Good question. Good question.
Okay, we've got another really good one. This is Audrey. She's asking, does the certified CPO need to add anything to the notes, or can they just sign off on the notes indicating that they have reviewed it or read it?
Great question, Audrey. Excellent question. They may. If they have more insight that they want to add to the notes, yes, they may do that.
Right.
And you sign it and you date it, the date that you are adding. Do not date it for the date the service was provided. I mean, if it's the same date, then that's great. That's perfectly fine. But if you read it and review the notes 3 days later, make sure you please date the notes the day you sign it.
And I'd imagine if there's anything that they see is missing, then by all means they should definitely add their own notes.
They will add their own notes. Exactly. Not notes from the person who's done the original person, the original privileged staff member, but they add their own notes as the supervising practitioner.
Right. And then they probably want to follow up with that individual.
Without a doubt.
Yep. Okay. Let's see. Some of these are a little in depth, so I'm just taking a second.
That's okay. That's okay. And honestly, if we have questions that are a little more in depth, that if Megan feels, and I'm not seeing questions right now, Megan's just asking me. If we have questions that are going further in depth, we will get answers for you. Okay. I know we just have a few more minutes left, but we will get answers for you. And when we send out the email with the information, it won't be the initial email you receive because you'll be receiving the survey very quickly. But we will get answers to each of these questions specifically, and we'll share them with everyone. Okay.
Okay. We have several questions about people being BOC certified, and they just want clarification. I thought we would just follow up on that again, that the BOC,
Yeah, that is
an
right.
individual cannot be privileged by a BOC.
Right. An individual would not be an under ABC. You would need an ABC practitioner to do that. Only because, well, it's just there's some differences here and there, but that's specifically the case. And if we find out that that is different, I will let you know immediately. But ABC follows that rule.
Okay. Okay, asking about a recommended template for privileging of new orthotic fitter staff members who have not taken any classes or passed their boards yet.
Okay. We did give the example, and we're going to send this out. If you would like this information, we'll send it out. Kind of an idea of how you can create that that written objective criteria. along with, if you're accredited with ABC, as I mentioned on our website, we do have the different privileging template. So please go right ahead and use that, and you can expand on that also. So that's a great start. But remember, when it comes to the documentation and the written objective criteria, and this goes with so much with our profession, we need to tell the story remember, and as we're doing patient notes, we need to tell the story of the patient. As we're doing privileging, we need to tell the story of the person who is being privileged. We need where they come from, what are they doing, how did they get there, what progression did they make, what was their education, who taught them, was it internal by staff members? That's perfectly fine. Was it a course that they took? Was it, and just on and on. You need to tell that full, complete story, and that will be suffice for the surveyors, and you will be compliant with privileging.
Okay, thanks, Jim. Let's see, we have another question from Ashley. This is a pretty good example. She wants clarification on if there is a clinician that is credentialed in prosthetics but not orthotics, can they treat an orthotic patient or provide orthotic services under indirect supervision?
As long as they're privileged, yes.
Okay. Yeah, so it would be indirect supervision instead of direct because they are credentialed.
Exactly. And we have an example of, we had, I know someone very dearly who's a practitioner, and he's been practicing for years, probably over 20 years, probably 20 years. And he just recently, and he had to be privileged. He was only in O, and he had to be privileged in P to do the work. Unfortunately, he just passed his board exam, so he's now both. But up until then, that's what he needed to do. And of course, you know, obviously, with the experience that the practitioners have, they do a great job.
Another question, can an administrative assistant or office manager be privileged to provide something such as compression garments, and would the practitioner actually need to be in the room during the visit?
Yeah, I'm assuming this is, and maybe I shouldn't assume. Yes, I'm assuming this is mastectomy boutique. The answer is yes. You must have a certified fitter, and doing the privileging under a certified mastectomy fitter. The answer is yes. It will be direct supervision, okay, and that mastectomy fitter must be available to supervise, okay, to fill in content, to speak and address, and to be able to, even if it's to be able on the phone, if you use FaceTime or Skype, to be able to do that, to show exactly what's being done, to supervise and consult with that.
Okay, great. Okay, next question from Lindsay. She's a CPO, and she is, if she's privileging an orthotic fitter, the fitter is not certified, so she's an orthotic fitter, but they haven't taken their exams yet.
Okay,
so,
okay, great.
They're providing orthotic fitting services.
Wonderful.
She's assuming that currently she would need to, she needs to co-sign the notes and supervise that individual, correct?
That is correct. And once that person sits for their board exams and becomes credentialed and certified, then that won't be necessary as long as everything that person is doing is within their scope of practice, for their orthotic fitter scope of practice. If they want to go outside of that scope, then once again you would go back to making sure that person is privileged. You as the practitioner making sure that person is privileged, and go through the whole written objective criteria, all of the information and documentation that's needed, because once they become a certified orthotic fitter, they can do everything within their scope of practice without your supervision. Now,
okay,
that being said, as a staff, we all want to check on each other's work and make sure everyone's doing a good job. Just, you know, a second set of eyes is always a wonderful thing to have.
Okay, great. This is another good question here. It states, if you are privileging an employee with many years of experience, can you still go back and list the courses and previous experience, or do you need to start as if it were day one?
No. There are many practices that have people working in their practice with a lot of experience. List that experience, okay? Go ahead and list the experience they already have. Do the written objective criteria for that. But don't forget a point that I made, okay? Even though they have a lot of experience, we all need to continue learning with the new technology, the new standards, the new processes, what's out there. We all need to continue our education, okay? Even if they're not certified, they still need to do that. If they're going to be doing any work with you, they still need that continuing education. That's something that's very important. Do you have one more question, Megan? I think we're getting close to our time here.
Yes, we are.
And once again, those questions that aren't answered today, there's been one or two that I went, you stumped me. Okay, you got me on that, which I'm
Okay.
glad. I'm very happy for that. We will get those answers to you, and the ones that we haven't responded to, we will get the answers to also, the ones we don't have time for.
I have a couple of the kind of twofold for residency, and I know
Okay,
a lot of our accredited facilities are residency sites, so we'll kind of touch base on this because
sure.
that seems to be a very important topic for folks. So they want to know if the resident can privilege and supervise a non-credentialed person.
Oh,
So
what a great question. I'm guessing, and I'm just making the assumption that the answer is no on that, because they're a resident and they're not certified, and
right.
they would not be able to privilege anyone. That would go through INCOPE and ABC, but I would be extremely surprised if they could. I'm gonna go out on a limb and answer no. But
Um,
I will check. But I will check. I will check to make sure I'm right.
okay. And then as far as the residency is concerned, can their training during residency be used as part of the written objective criteria later on for privileging?
Yes, it can. But once they finish their residency and they apply for their board exam, once their application has been accepted for the board exam, then they are able to work in a practice. They are able to do that. So that kind of is covered by both ways. And yes, you can use that by all means. You can use that experience during the residency as for your written objective criteria. Yeah, I mean they're getting a great education. I look at residencies as they finish their master's program, and I look at the residency as the next year or the next 18 months of their continued education. They are being educated very well. The practices that have residency programs have been through the whole process through INCOPE, that they're approved, they get the survey out there, and they're doing a great job. And just I'll get on my soapbox a little bit here. If you haven't considered having a residency program in your practice, take a few moments to consider it. I think you can get it done in about 6 weeks. We got great. I go to all the universities that offers the master's program. I speak to all of the master program students. I speak to them after they graduate, as they go into their residencies. They're good people. It's not just a benefit for them, but they bring a lot of education and a lot of benefits into a residency program. So anyway, I don't work for INCO, but I think it's a great program. So that's kind of where I am on that. I see we have hit 3 o'clock. We got a couple more things real quick, Megan. Let's finish it up. Everyone, go ahead, Megan. Sorry.
Okay, yes. So if we didn't get to your questions today, we will certainly take a look at the log and try to get some answers out to you. And definitely contact us, reach out to us, and we will get those questions answered.
Can you hop to the next slide for me?
Yes, absolutely.
Awesome. Okay. So actually, one more. There we go. Here's our website, abcop.org. Don't forget our scope of practice is on there. The big My ABC button. Click on that. Insert your information and be able to pull those things down. Okay. Let's go. I thank you very much. We're here to help you. Here's my email address. I'm Jim Lawson. Here's my email address. Steve Fletcher is beside me. Steve Fletcher is our clinical director of clinical resources. Many of you know Steve. Steve is a past ABC president. He has extensive knowledge on privileging. He has been one of the ones he's been integral in helping us put this webinar together today, the presentation. He's got a wealth of knowledge. He has a lot of that in-depth knowledge. The ones that I went, I'm not sure on, Steve is sure on. Okay, so please take down these email addresses. If I can't give you the right answer, I definitely will get it for you. All right, Megan, anything else to add?
Yeah, just want to remind everybody that we will be sending a follow-up email. It will include all the links for everything, which includes the handouts, the quiz, and a survey. And then if for some reason you missed the email, don't worry. You can go to abcop.org, go to the accreditation section, and there is a webinar library available. And on the library will be the recording from today, and as well as a link to the quiz. And anyone on staff can access at any point and still receive the credits.
And this website, this webinar will also be on our YouTube channel, correct?
Yes, it
Okay,
will.
excellent,
It'll be on our YouTube channel, and so we'll try to provide all that information as many ways as we can, and you should be all set.
Great.
And we
Thanks,
thank you.
everyone. Yeah, thanks for joining us today. It has been a privilege, and that pun is certainly intended. Privilege to be with you today. So don't hesitate to contact us with any questions. I look forward to seeing you. I'm at all the meetings all over the country. Wherever you are, I am. Please do me a favor. Come up to me. Say hi. Okay? I'm that ABC guy. Please come up and say hi. I would love to meet you face to face. We thank you for your time today. We've gone about 2 minutes over. I apologize for that. Have an awesome day, everyone. Bless you. Thank you so much.
Thanks.